As a dentist who provides sleep services through oral appliance therapy, you obviously want to do more sleep cases. But the problem is you don't have a predictable system that allows you to move and progress patients through what we call the 5 levels of appliance awareness. Now, on the training video that you can access, somewhere around this video, you can click and access training video. We'll walk you through exactly what those stages are and how to progress patients through those. But first, I want to introduce you to Dr. Cuffy York. When Dr. Cuffy York started with us, he had just sold his general practice that was doing $120,000 to $140,000 a month. He was seeing 30 patients a day over 8 operatories, and he decided he wanted to focus on sleep, but he had no way to attract sleep patients to his practice. Now, this practice only focuses on sleep. Well, in his first 30 days with us, through our system, he was able to do $20,000 in sleep appliances, and that was in the middle of a pandemic shutdown. And since restrictions have begun to lift, he has gone on to do 15 to 20 appliances per month consistently. Now, how do you go from general practice with 70% overhead to doing sleep only and seeing a quarter of the patients and making even more money than you were in your general practice because sleep has a 30% overhead? How do you do that? You have to gain what's called opportunity control. Now, if you're trying to build your sleep practice the traditional way, you are going to come up against some very, very frustrating hurdles. When you're communicating with MDs, they are not responsive. You have patients who have done home sleep tests, but you can't get a response. You can't get a prescription written for a sleep appliance. When you're trying to build out that referral network, communicating and educating doctors, you get met with a lot of animosity because you're a dentist and you're driving outside your lane because you're not a real doctor. That can be very, very frustrating when in fact you know a lot more and you're probably more educated on obstructive sleep apnea and the ways that you can treat obstructive sleep apnea effectively. You're probably more educated. So you're going to run up against a lot of hurdles and obstacles. Whereas if you had opportunity control, where you were able to control the number of patients reaching out to you every single month about obstructive sleep apnea and treating it through oral appliance therapy, you wouldn't be dealing with those headaches anymore. This is Dr. Manning. Dr. Manning, she is so amazing, such a great attitude. She had done less appliances the complete year prior than in her first 30 days with us. She did 4 sleep appliances in her first month working with Dental Sleep Profits. Again, the entire year prior to that, she hadn't even done that many. This is a huge, huge step for her toward a sleep practice that is absolutely thriving and gives her the option of pulling away from general dentistry and only focusing on sleep. And I've talked to hundreds and hundreds of doctors who practice sleep very, very successfully, and they all agree that sleep right now is what dental implants were 35 to 40 years ago. This is going to become a massive market, and I want you to take action on that. If you have integrated sleep into your practice, or maybe you haven't integrated sleep just yet, we can help you. We can help you grow your sleep practice effectively and quickly rather than you doing it on your own and running up against those frustrating hurdles and headaches that you're going to be dealing with MDs out on your own. So what I want you to do somewhere around this video, I think the mobile link is up here and the desktop, if you're on desktop, the link is right down here. Click on that link. Put in your contact details and watch that free training video that I developed for you. And then after that, I want you to implement what you learn on that video. We take you through step by step what you need to do to get sleep patients in the chair in the next 7 days. If you take action, you can have a sleep appliance case moving forward, and you could be collecting on that within the next 4 to 6 weeks if you follow that training. So I want you to go ahead, sign up for that, watch the video, and implement what you learn, and hopefully we'll be seeing you on the other side. God bless.